Hello, my name is Dr. Doug Pooley, and I'd like to welcome you to the theun-dietdiet team. First, I'd like to thank you and congratulate you on making the best possible investment you ever could in your whole life, and that's in your health. If you're over the age of 55, you understand what health is all about, because I'm sure you've experienced both sides of it. So the whole purpose of this program is empowerment. What I want to do is give you ideas, tools, protocols, and most of all, some hope that you can reclaim at least part of your health and re-enter your world as a participant rather than just a bystander. Part of this whole program, of course, is there's some remedial activities and exercises which are designed to knock some of the rust off those pipes of yours. Now, everybody knows there's no free lunches in life. And the whole purpose of this, again, is to give you a sense of accomplishment as well as some empowerment, and finally, a sense of confidence in what you're doing is going to be the best for you going forward. So, in just a couple of seconds, I'm going to walk you through the purposeful activities associated with the program. We're going to start off with purposeful breathing. So at that note, again, welcome to the team, enjoy the process, and leave your comments. Thanks. Appendix A, Phase 1 Breathing Exercises. As we have already discussed, efficient breathing is an essential component of life and one of the primary tools we will employ in rebuilding your health. The following exercise is your Phase 1 breathing tool. So, first, sit comfortably on a straight back chair as demonstrated. Make sure that your legs are spread comfortably for support. Place your feet flat on the floor and ensure that your body is positioned upright, 3 to 4 inches from the back of the chair. With your right hand resting over your navel and your left hand positioned comfortably on your chest, relax and breathe normally for approximately 1 minute. Feel your tummy move out and your chest rise as you breathe. Blow out while gently pressing against your tummy with your right hand. Release the pressure from your right hand while maintaining the contact with your stomach. Inhale deeply but comfortably to a count of 5. In doing so, feel your stomach push out against your right hand and your chest rise under your left. During inspiration, actively extend back to the point where the upper back gently touches the chair at the end of the breath in. Hold the breath in for a count of 5. Breathe out to a count of 7 while gently pressing in your right hand against your lower abdomen. As you breathe out, move your body forward approximately 30 degrees beyond the original upright position. Break between reps for 10 to 15 seconds while breathing normally, and then return to the original upright position and repeat the activity 5 times. With each breath, try to draw in more air and blow out with just a little more force. When you have completed the activity, rest your hands in your lap and breathe normally for at least 1 minute or until you are comfortable enough to stand up without feeling lightheaded. If after resting you continue to experience any lightheadedness, remain seated until you can comfortably stand up without distress. These are the Phase 1 stretches. The following stretches are designed to activate the restricted muscles, soft tissues, and joints that have been potentially compromised from a range of motion perspective due to wear and tear, disuse, or injury. Please note that these activities are to be done on the bed, not on a hard surface. Please ease into the exercises and never take them into pain. You should feel a gentle stretch of the targeted muscles, but not significant discomfort. Some may find one or more of these activities a bit too taxing at the start. This is okay. Simply do the ones that you can and ease into the rest to the best of your abilities over the next few days. Lie down comfortably on the bed with your knees up as illustrated. With your arms resting by your sides, palms down, raise your head up approximately 1 to 2 inches and hold for a count of 5. You will notice that as you raise your head, you automatically suck in your tummy and flatten your back. Do 5 repetitions. Exercise number 2, start with the same knees up posture as assumed for exercise number 1. Grasp the right leg behind the knee as illustrated and draw the limb towards your chest. Be sure to keep the stretch comfortable and never go into pain. Some of you may not be able to comfortably grasp your knee as demonstrated. In these cases, do your best to bring the knee up and hold it in a flexed position as per your tolerance. Your goal is to hold for a count of 5. Gently release back to the start position. Do 5 repetitions with each leg. If this is too taxing at first, start by simply alternating the lifting of each knee towards your chest to the best of your ability. Exercise number 3. Start number 3 just as you did exercise numbers 1 and 2. Your goal is to grasp behind both knees to the best of your ability and draw them both towards your chest. Again, never go into pain. If it is too difficult to grasp behind the knees, simply raise them together up off the bed to the best of your ability. Draw up one knee at a time initially to establish a hold behind the knees and then draw them together towards your chest. Hold for a count of 5. Release partially while maintaining your grip behind the knees, then draw them back again towards your chest for 5 repetitions. For exercise number 4, the start position for this last stretch is the same as the previous 3. With your hands by your sides as illustrated, keep your knees together as best you can and slowly let them drift to the right. Hold for a count of 5. Return the knees to the neutral position. Hold there for 2 seconds. While maintaining that same position, let them drift to the left. Hold for a count of 5. Return to the neutral position. Repeat the process for 4 more times for a total for 5 of each side. Now that you've finished the 4 exercises, rest in a neutral knees up posture as illustrated for 2 to 3 minutes. Turn on your side to rise up off the bed. Sit at the side of the bed for at least 1 minute to ensure balance before you stand up. If at all dizzy during the process, maintain that seated posture until you can comfortably get up without any discomfort. Phase 2, legs and hip strengthening exercises. As we move into phase 2 of the program, we are going to start activating more muscles in the lower body, especially the hips and legs. These activities are designed to promote strength and continue improving flexibility. As some of you may not have exercised for extended periods of time, it is important to ease into this and perform the activities without undue stress to the best of your ability. As we go through phase 2, your depth of stretch and levels of strength should continue to build, so be patient with your body. First, make sure that you have a chair behind you in case you lose your balance or become fatigued. As illustrated, stand comfortably facing a wall with your arms outstretched while supporting yourself. With your legs positioned shoulder width apart and hands against the wall for support, take your time and bend your knees to approximately 60 degrees as shown. Hold for a count of 5. Slowly rise back up to the upright standing posture. Rest for a count of 3 and repeat for a total of 5 repetitions. Phase 2, exercise number 2. Turn to your right while maintaining contact with the wall using your left hand for support. Lift your left leg up 2 to 3 inches by bending the knee on that same side. As demonstrated, gently swing the left leg from back to front, never going past 45 to 60 degrees in either direction. Do 5 swings on the right. To work the other leg, turn around so that your right hand is supporting you against the wall. Now raise your right leg as you did with the left and repeat the exercise 5 times. Note, just being able to stand on one leg is an accomplishment for some. If this is the peak of your comfort zone, don't go beyond this point at the start. Hopefully, you can work into full activity over time. If you are at all apprehensive, face the wall with both arms outstretched for support and do a shallower leg swing. Fourth exercise, stand facing the wall with your arms outstretched for support in a chair positioned comfortably behind you as illustrated. With your knees slightly bent, consciously tighten your buttocks and hold for a count of 5. Take a 3-second break between reps and repeat the process for a total of 5 reps. Attempt to make both sides of your butt contract evenly. For the fifth and final exercise in this set, continue to face the wall with your arms outstretched and the chair still comfortably behind you for support. Rise on your toes as demonstrated and hold for a count of 5 and return to a feet flat position. Take a 3-second break between reps and complete for a set of 5 repetitions. Having completed the 5 exercises, relax for a couple of minutes before moving on to the rest of your day. Phase 2 deep breathing exercises. Comfortably sit in a straight back kitchen or dining room chair. Position yourself so there is approximately 4 to 6 inches between you and the back of the chair, with your legs placed comfortably to the outside. If you are able, raise your hands over your head as demonstrated. If you cannot, position your arms at a comfortable height away from your trunk. Flex your body forward as far as you can without discomfort while exhaling fully. Raise your body back up slowly using a 7 count as you inhale. While breathing in, extend your arms out and up to the best of your ability, as shown. As you raise your trunk up while inhaling, extend back to the point where your shoulders are comfortably touching the back of the chair. Hold the breath in for a count of 7. Exhale while again flexing forward, this time blowing out to a count of 10. Blow as much of the air out as possible while returning to the fully bent over position as illustrated. Without resting beyond 10 to 15 seconds between breaths, repeat the process 5 times. When you have completed the exercise, rest comfortably for at least 2 minutes to allow your head to clear and to ensure a state of balance prior to rising from the chair. Note, never force the movements unduly. As with all of the prescribed activities, perform them without exertion to the best of your ability. They will become more comfortable to complete as you go forward with them and do them more often. Phase 3, band exercises. This advanced series of exercises will be the most demanding from a strength and exertion perspective as we start to work to engage the muscles of the upper body. These exercises will round out your strength and endurance to stabilize and increase the work capacity of key upper body muscle groups. They will help you to more comfortably and efficiently engage in activities that involve the use of the chest, back, shoulders, and arms. General instructions. Position a chair comfortably to allow you to move your arms and legs freely while performing the activity. Sit while holding your level 1 exercise band. We are going to do 5 upper body exercises designed to engage muscles of the upper torso to improve strength and tone. All repetitions are done to a 4 count with a hold, as will be demonstrated. Keep the resistance light initially to avoid straining the muscles. If you do not have bands, you can start by using regular size cans of soup until you get one. Please note, I suggest that you go through all of the exercises first without the use of bands to lightly condition the muscles prior to using any weight or resistance. This will serve to ensure your ability to comfortably perform the activities. Again, go at your own pace and never force an exercise. Exercise number 1, band pulls for rear shoulders, upper back, and outer arms. While sitting on a sturdy chair with your back straight and core tightened, plant your feet firmly on the ground. Grasp both ends of your resistance band as demonstrated. Hold the band in front of your chest with your elbows bent. If your resistance band is too long, shorten your grip before starting as per the illustrations. Inhale while pulling the band out by separating your arms as demonstrated for a count of 2. Then hold for a count of 2 at the end of the range. Exhale while slowly releasing the tension and returning to the starting position, again for a count of 2. After returning, take a 2-second break and slowly repeat 5 to 10 times. Exercise number 2, bent over extensions for upper back and arms. While seated, step on the resistance band and grip the handles or ends of the band comfortably. Shorten your grip if necessary, as illustrated. Tighten your cord to protect your lower back and bend your upper body forward until you are flexed over and parallel to the floor or as far as you can find comfortable. Inhale and slowly pull the handles upwards and out for a count of 2. You should feel your shoulder blades draw closer together with your elbows facing up towards the ceiling as demonstrated. Hold for a count of 2. Exhale and slowly release back to the starting position again for a count of 2. Take a 2-second break and repeat the process 5 to 10 times. You can move your feet wider apart to increase the resistance or position them closer together to decrease the tension. Never force the exercise. Tension on the band should be consistent but never forced. Exercise number 3, bicep curl. You can perform this exercise while sitting or standing as a matter of personal comfort. For standing, rise from the chair but ensure that it is comfortably behind you for balance in case you need to sit during the activity. For sitting, follow the illustrations below. Step in the middle of your resistance band with both feet as demonstrated. Your feet should be flat on top of the band at approximately shoulder width. Grip either the handles or the ends of the band comfortably and space it equally on both sides of your body. With palms facing forward, flex your arms up towards your chest as illustrated for a count of 2. Return to the starting position for a count of 2. Take a 2-second break between reps and repeat 8 to 12 times. You can increase the resistance by simply shortening the band while gripping farther up the length of the appliance as demonstrated. Start with minimal resistance for the first day and then allowing the muscles to adapt. Exercise number 4, chest press. Place the resistance band behind your shoulders and hold both ends equally positioned in front of you. Make sure that the band is far enough down your back so it does not slip up. Then rest your back against the chair to further stabilize the band as illustrated. With elbows up and away from your body as shown, extend both arms out slowly in front of your chest for a count of 2. Now hold that position again for a count of 2. Returning to the starting position for a count of 2 more seconds, then break for a count of 2. Repeat the process 8 to 10 times. You can do this while seated or standing, but seated is preferred. Perform the activity methodically and never force the exercise. Exercise number 5, seated shoulder press. Start in a seated position on a chair with your knees bent and feet hip-width apart as illustrated. Keep your back straight, abs tightened, and feet on the floor. Sit on the band as shown with equal lengths on each side of your body. Hold the ends of the band with your arms bent at the elbow as close to 90 degrees as possible. Exhale while extending hands up towards the ceiling as shown for a count of 2. Inhale again for a count of 2. Slowly return to the starting position to complete 1 repetition. Rest for a count of 2. Repeat for a total of 5 repetitions on both sides. To make it harder, you can shorten the band by curling it in your hands for more resistance. Make sure that the band lengths remain equal. Exercise number 6, tricep extensions. While seated, extend your legs out in front of your body while maintaining the feet flat on the floor as shown. Place the band under both of your feet equally spaced as demonstrated. While holding firmly onto the loose ends of the appliance, position your arms down and flex them slightly with your palms facing forward. Extend your arms and hands back as shown for a count of 2. Hold the arms extended for a count of 2. Return to the starting position again for a count of 2. Take a 2-second break between reps and repeat for a total of 8 to 12 repetitions.